this year, the Lifetime Achievement Award is awarded to Ron Weiss. And for me, really, it's an honor, but even more a pleasure to present the World Vasectomy Day Lifetime Achievement Award to my friend and colleague, Dr. Ron Weiss. Our relationship goes back to 1992, when we were the first two Canadian physicians to introduce the no-scalpel vasectomy in Canada. Indeed, Ron was so fond of no-scalpel vasectomy that he had one in 1993, just 1 year later. And you know, I can testify because I did his vasectomy. So
and then prepared a complete 6-course gourmet dinner for us, for my wife and us, at the same night. It was quite spectacular.
We're just preparing so you're not too nervous, and with a good bottle of wine, I remember. So Ron's role as an international key leader in no-scalpel vasectomy is tremendous. Let me just read you the list of a few of his contributions to improve the vasectomy practice and services. The development of wall-mounted anesthetic bottle holder, allowing for the drawing up of local anesthetic solution without an assistant. The pinch technique in vasectomy to aid in the closure of the vas deferens following thermal cautery treatment. The development of handheld battery-operated thermal cautery device we're all using in Canada. The modification of the Metajet injection device for the no-needle anesthesias applied to vasectomy. The publication of major scientific articles on the efficacy of the no-needle anesthesia technique that really made a change in the practice of vasectomy, and the modification of thermal cautery electrode. Actually, Ron is so famous.
Ron es tan famoso vasectomía. En Ottawa, donde él trabaja, que recibe vasectomía, dice que han sido Weiss.
Actually, Ron can give us exactly the count of vasectomy he did, but I would say 57,000 vasectomy. Ron has set the bar very high for colleagues.
Muy rápido para todos nosotros. 65,000 vasectomías. Una cosa que sabe. Es un músico también. Y para entenderlo, debes escucharlo.
You mean everything to me.
Ha escrito su propia canción. Él hace toda la orquestación, juega su música, piano y guitarra y canta también.
Weiss music. Mostly what you will realize is that Ron is filled with love and hope for all of us. To quote Ron, "For what it's worth, I choose to embrace today." Our World Vasectomy Day honors Ron for all the contribution he has made over the years to the art and science of vasectomy, for his leadership, and most of all, for the men, women, and families he has taught, influenced, and empowered. Thank you, Ron, for choosing the heart, as well as the scrotum, of course. Thank you, Ron. So I'll let la parole to Doug and Ron, and for open conversation. And please, Ron, tell us more about you.
Do we have a little video, Michelle?
Oh, probably. Et voilà.
That's beautiful.
Well, shall I carry on?
Yeah, please.
This is a golden opportunity for all of us to maybe throw a couple of questions out to the man who has certainly done more vasectomies than anybody in the Western Hemisphere, or maybe in the world. I'm not sure. I'm sure he's well over my number. But I would like to say that I met Ron in 2005, and I went up to Ottawa to see him because I was intrigued by no needle anesthesia and having to work out some problems myself. And I'm looking for an office. He gave me his address, and I'm looking for my office, and I'm driving up and down this street. And this is a residential street. So I pull up to this nice big house, which is the number. And as I get closer, I see a little sign. It's about this big. I forget, I think it says Dr. Weiss vasectomy or something like that. And it points down to the basement. And I was just shocked. Here is the man who is doing more vasectomies than anybody in North America. And he's doing them in the basement of his home. In fact, I meet his lovely wife, Debbie, and Debbie describes him as a vasectomy machine. Day after day, year after year, Monday through Friday. I think it's 13 a day, 65 a week. Nothing stops this guy. So I was, needless to say, sort of humbled myself to be able to visit someone who had been so innovative and so creative. And Ron, how did you? It's probably interesting to the other people. Here I am spending thousands of dollars in advertising, trying to promote vasectomy, and he just has this flood of men coming in. So I guess I'd like to say, to inspire all of us, how did you establish all this?
Well, if I go back to the beginning, in 1991 is when I did my first vasectomy, and there was a doctor in town who was the vasectomy king, did a lot of vasectomies. I won't mention his name, and the reason is he lost his privileges at the local hospital, and he was a surgeon, and so he set up in his office doing procedures. And when I went to train on vasectomies, he was very generous of his time. I witnessed that patients were writhing on the table, one after the other. And I gathered what I could from being with him for a number of sessions, and then started on my own doing vasectomies. And then, as Michelle said, a year later, no scalpel vasectomy came up, and Michelle was trained in July 1992, and I was trained in August by Philip Shihua Li. Shihua was trained by the original Dr. Shengqiang Li, and was just a wonderful teacher. And I think I've learned lessons. I've learned, I think, great lessons from various people, including you, Doug, and Michelle, and others. Over the years, one of the most important things I learned from Shihua was close your instrument silently. Your patient is awake. And I'd never thought twice about, the crunch when you lock your instrument. But from that day on, I closed my instrument silently. One of the most important things that I learned from you, Doug, was when I went to the Philippines the first time with you, you said something about bringing my loops. And I said, what loops? And you said, you don't use loops? And I said, no, they cost thousands of dollars. You said, try them once, you'll never go back. And indeed, it was like night and day. Michelle helped out in the 1973, April 93 was the first training session that I organized in Ottawa for about 50 physicians, and Michelle came over. And I think, as he mentioned later that year, he did my vasectomy, and I mentioned that he made this beautiful dinner for us. And what he did also in that dinner was for dessert, he prepared a cake, and the cake had a beautiful design on the top consisting of, I think it was like a carrot and 2 cherry tomatoes in icing, but it was a carrot and 2 cherry tomatoes. It was just funny and fun. And I think that's one of the most important things that I learned was not to take it too seriously and have some fun. Jumping forward almost 10 years, one of my colleagues in Vancouver, Barry coined the term helping men become unproductive men, helping men become unproductive members of society, doing vasectomies, which I thought was tremendously funny. And he said he visited this Dr. Chick Wilson, who was using this this device, this jet injector, and I looked up. Chick had published something in American Family Physician, and I became entranced with this idea of not using a needle, again, not causing any more discomfort than necessary, and started working with a company, Dermojet, who made these. The jet injector was originally invented at the end of the 1800s in France, and I think Dermojet might have picked up on it, or maybe even been the first manufacturer. And started working with them, and Chick was doing a lot of great work, including there's a little silicone or plastic spacer that went on the end of the injector, and he carved out a groove, which gave me the idea that if we could make something that obviated the need for a doctor to carve something out for himself, that would really help, and did that, and had worked with the manufacturers to do the same. So I think that I didn't do anything special. You all did a tremendous amount of special things that has certainly helped me and certainly brought us here. I mean, this organization that Jonathan and you have worked on doing. I think that you must have. I haven't asked you this, but I think that you must have realized that reducing the number of unwanted pregnancies has a tremendous impact on society, not the least of which is reducing crime. And providing vasectomy services is one way of reducing the number of unwanted pregnancies. And I know certainly Jonathan, you Google him, the pictures that come up, what is he wearing? He's wearing a vasectomia sin bisturia or t-shirt. He's not in a suit and tie. He's wearing that t-shirt. So I know that he's tremendously, in spite of all of the other things that he has done, that he is tremendously passionate, as are you, traveling around the state of Florida with 2 big suitcases providing these services. I know that you are tremendously passionate about it, and I think that my long-winded answer to your question is, you guys have taught me a lot.
Well, Ron, as we learned way back when I went to, as a matter of fact, you went to India at one of the NSVSI meetings, the real success story is the conversion of a geographic area from a place where tubal outnumbers vasectomy to a place where vasectomy outnumbers tubal. Now, I think Michelle will attest to the fact that that's the situation now in Quebec, if Michelle can come back on. Is that the situation in the Ottawa area, do you think?
Actually, we do in Quebec, and we have fairly good numbers. We do about 3 to 4 vasectomy for 1 tubal ligation.
Wow.
Yeah.
Yeah. And that's in the province of Quebec. Is there any way to trace that in the province of Ontario?
Of course. I don't know. Ron?
I'm sorry, I don't know the numbers. I did do some research, I don't know, 15 years ago about this, and it looked like like there was a trend, obviously, with vasectomies outnumbering tubules. But today, I don't know. There's what's one of the wonderful things that has happened in this city is that um, that vasectomy has attracted a lot of attention, and it has over the decades become a rite of passage. And it's kind of almost taken for granted that you get married, you have children, and the guy gets a vasectomy.
Yep.
It just seems like an automatic step. And I think what uh, I think one of the things that shows me how that has happened is the spectrum of people that are now coming for vasectomies. Whereas when I started in
Cuando yo comencé en 1992,
you would see
eran casi
university educated,
gente de educación universitario, ejecutivos, gente de más
not blue
educación,
collar, white collar,
más gente de trabajando de
today I
ahora
see
ya ve todos, viene de gente pobre a gente muy rica, a blanco, negro y todos, gente de.
And I think that attests to the fact that vasectomies, at least in this area, have become it's become normative.
Yes, absolutely. I mean, I'd love to see that in Florida. I don't have the statistics because a lot of patients are private pay in Florida, or they have varying insurance companies. So we can't get our statistics together quite as well as when you have a single payer system. But we just keep plodding on every day. But how do you handle every day going downstairs doing 13 vasectomy? I mean, sometimes on some days I do a little administrative work, or sometimes I do a little training or a reversal or something, but you always seem to, as your wife says, you're the vasectomy machine. How do you keep an interest in doing that day after day?
I want to make this answer interesting because I know it's about it's past 4 a.m. for Nick in Melbourne. I don't know how he's staying awake through my long-winded answers. I do 14 a day, so it's 70 a week, and I don't get sick of stuff. I just don't get sick of it. It's not a great answer, but everybody is different. And yeah, I know I kind of swear to myself. I swear to myself with all those difficult cases. It's like when you're a family doctor and you get a bunch of colds and flus, and then you get the most difficult diagnostic dilemma. It kind of the colds and flus pay for the time that you spend on the difficult cases. But I know when I do those difficult cases that it makes me a better vasectomist. So I'm swearing while I'm doing it, but I'm not swearing afterward. But I don't know. I don't get sick of it.
Yeah, I think it becomes a real talent. I can see from the way you hold your hands, and you're very confident with your hands. You're a guitar player and a piano player. And I've seen your hands work both at your office and in the Philippines, and they are just elegant. The confidence that you have and the smoothness of your movements. Do you think that that's learned, or do you think that that's innate, or do you think that that's acquired from being a musician?
While we were in the Philippines, and we got this one terrible case of a guy with an indirect inguinal hernia. I don't know if you remember this, just massive, and it was not reducible. And it was just a very, and it was my patient. And I said, I didn't want to hurt this guy. I didn't want him to have some massive bleed on top of this. And so I asked for some assistance, and Ramon came up and did that vasectomy in no time. And Ramon and I are about the same size. And I realized that I'm small. I'm a small person. I've got these small hands. I'm a fingerstyle guitarist. So both of my hands are, I've got strong fingers. And I think that I think that that's really assisted me. I mean, I don't know what instruments Ramon played or plays, but he also just having these small hands, I think helps.
Great. I don't want to hog all the questions. I can go on with Ron all day. Do we have anyone else that would like to ask any questions on what we wanted to be sort of an open conversation here? I'd like to meet some of you face to face. So if anybody wants to chime in, please raise your hand and we'll open up your camera and your mic to join us. If not,
Doc, by the way, you could probably with Ron and keep the conversation. We should probably go on the next topic. So
sure. If I can have my first slide, what I've come up with, Ron, I don't know if this was you or someone else. And this is a little bit of a stretch. I'd like to have my first slide there where it says, I think it's called Stein, vasectomies in young men. Because these are some of the conversations and the exchanges on the vasectomy network that I enjoy the most. I like the stuff about post-vasectomy pain syndrome and infections and, technical difficulties. But some of the things that I enjoy the most are the social considerations, because they're the ones that will really challenge me a little bit on, boy, should I be doing this vasectomy? So again, I had a couple of slides that I sent in to Luis and to Sheila this morning. I don't know if he has those, but okay. Basically, it's those, I'll say young men, where we review their history and you ask yourself, should I really be doing this? And let's take, for example, here's my list. Can we have the other one, please? The other slide of these two. There's only two. What I've compiled is sort of a list of the tough decisions I have that should I be doing this vasectomy? And we do review these sometimes on the vasectomy network, and it's usually a young man with no children. And we all have expressed our opinions on this, but I just wanted to open this because it's a little bit more complex than the 22-year-old who has no children and he says that he doesn't want any children. It's the other slide. I have two slides with this. And I believe, unless the other one didn't go through for you, we could go with that second one first. That's kind of my case study. And I spent, about an hour or two cumulatively on deciding on whether I was going to do this case.
Let's see what happens.
We'll give you time. So just carrying on, we'll get to the story in a minute. One of the tough cases that we always have is the vasectomy that is desired by the parent of the patient because the patient has a cognitive impairment. Or in this case of this case study that I'm going to present, it's a man who, and Ron, you had a very interesting one maybe 6 months ago or so, where the wife had intervened and asked you not to perform this vasectomy because she was about to leave the guy. Boy, did that really lit up the vasectomy network in terms of responses. But this particular case, if we can maybe have my one and only slide, if you're having trouble putting on the second slide, you had the right one there. This is I get a call from a woman whose son is 17 and he's a handsome, there we go. There's my list. That's the first slide that I wanted. So the case that I'm going to present is parental request. And this is a patients under 21 with a cognitive impairment or in this case, addiction problems, or the very young man with no children and no partner at present. We've even had requests for vasectomy from men who had never had relations. They just knew that they never want kids and they had never been in a serious relationship. Maybe they're the men who think too much about the well-being of the planet or whatever. Or let's say the very young man, let's say 20 years old with twins, his partner had complications of pregnancy and childbirth, and he was advised not to get pregnant again, and she was advised not to get pregnant again. The man whose planned youngest child is unborn. The man whose planned youngest child is 6 months. I don't know if you've ever had anyone who had a vasectomy when his intended youngest was a month old, and then he lost the child due to sudden infant death syndrome. The man on testosterone therapy with no sperm in his semen. The man whose partner has already had a tubal ligation, but they want to be sure. I'd like to just sort of open it to anyone who has any strong thoughts about any of these types of patients. Ron, what are your thoughts about these categories? Would you do the man whose intended youngest was a month old?
I don't, every case is different. Even if you give me a 20-year-old guy, every 20-year-old guy is different. Have I done vasectomies?
No, ya está, yo ya entré con los datos.
Go ahead. Oh, you got muted, Ron. I can't unmute you.
There we go.
There we go.
So I've done vasectomies on young people, including young men under the age of 20 with cognitive issues. And I did them only when I felt that they had an understanding of what was happening and they did not have to be restrained or drugged in any way in order to undergo the procedure. There haven't been a lot of them. I would think probably half a dozen or less. And they were in a relationship and didn't want to have an unintended pregnancy. But every one of them took some reflection in order for me to feel, in order for me to sleep that night. It took some reflection before deciding.
There has been some suggestion on the network that you get the evaluation of a psychiatrist or the evaluation of a judge to say that this is an okay thing to do. I assume that you haven't done that.
No, I have not. I think early on I did ask the ethics. I may have asked the ethics committee of a local hospital for some assistance. I can't remember details, but since then I've just decided on my own. The test for me is, can I sleep at night?
In Australia, Doug and Ron, in Australia, that decision is taken away from you as a doctor. And in fact, if you did operate on anyone that's intellectually disabled in any way, you'd basically be deregistered straight off. Even if the guardian of that person requested that operation, you cannot do it. You've actually got to go to the courts, and there's a specific court that deals with that matter. And the chance of actually getting it through that court is pretty well zero. I mean, the same applies to females with tubal ligation. So it's quite an interesting thing that in Australia, I would have thought Canada would have.
Canada, me imagino que tenía.
The same.
But actually, Nick, it's the same in Canada.
Misma Canada.
There was a case in Canada. A tubal ligation was done.
Ligatura de trompa.
Intellectually deficient girl, and there was a court a judgment that you cannot do that in Canada. So we have to really make sure that the person is able to make an informed consent. If he knows, I had one 2 weeks ago, and his mother called me, but I said, I have to talk to your son. And I talked to the son, and I said, do you know what is a vasectomy? He told me that it was a little operation not to get kids. And I said, what do you think about it? I said, I don't want kids. I cannot take care of kids. So, I mean, that was informed consent. And we discussed a little bit. So that was no problem. But the problem is when they cannot be, with their intellectual deficiency, they cannot give an informed consent. It's the same for the couple with a baby, a 1 month old. I just tell them, when I talk about this infant syndrome, the mortality, some couples, they will say, no, the doctor, we know about it. And we will, if we have 2 kids, if we have only 1, we'll live with it. And I say some other couples are telling me that, thank you, doctor, to tell me we will wait. So I say, what is your position between those two? And then I take the decision. So it's
interesting.
informed consent.
It's interesting that you've got, and Doug brought up the SIDS in Australia. That the risk of SIDS is so low that it's almost like the commonest time that people come to me for for a vasectomy. And there's the people that wait 9 years, and you say, why'd you wait that long? But the commonest presentation is the wife's just had the baby 8 weeks ago, and they come in, or had it last week and they come in. That's probably what I find is more the norm than, and the risk of SIDS is so small that that's like saying, well, what if your wife got run over tomorrow or something? It's sort of
Sure.
Probably more common.
Yeah.
I'm really glad that Chick Wilson raised his hand. I love Chick's insights into things. So can we put Chick's image on?
Yeah, I'll speak up. I totally agree with what all of you have said, and especially Ron just saying, man, it's always an individual call. I want to make one point that there's a difference between emancipated adults, those over in our country 18, who do not have a guardian assigned to them, and those who have a guardian and are not legally entitled to make decisions for themselves. Those do require the specific actions of a guardian, sometimes a court or something, and those are very complicated. But most of the people that we see coming in with mild impairment or even severe impairment, like the fellow that Nick put up in his slide on the TV, those people have pathology. But the question that I ask myself and that I try to determine, as Michelle so eloquently illustrated, is, does this person have insight? Do they understand what the meaning of the vasectomy is to them and their future life? So the question is this person manifesting insight? And if I have somebody who's a smart guy, but he comes in and he says, look, doc, here's my money, do my vasectomy, I'm not going to talk to you about my decision. That person, I can't establish a trusting relationship with, and I'm going to keep working with him or ask him to leave. If we can't develop that relationship, and if I can't demonstrate that he has insight into the decision he's making for himself, it's his decision, not mine, but I will not participate if I'm not convinced that that person has insight, whether he has an intellectual deficit or a personality disorder or whatever. It's all about him. It's not about me.
Thanks, Chick. That was helpful. If we can have this slide of my case, we're almost out of time here. We're supposed to end at 12:45 and it's 12:38. Can we have the second slide? This was kind of a tough case for me to decide on, and I'd like to hear what other people might have thought about this particular case. This is the first slide that you successfully got up before we had the list of other ones. I'll start out. This is a fellow who I got a call from his mother. He was 17, and he is a very handsome young man, very, very charming. She sent me pictures of him, good-looking boy that, is just attractive to the girls. But he wasn't home at the time because he was out in Montana at one of the most expensive drug rehab facilities in the country. It was an equine where they learn to work with horses, and hopefully that will break their addiction to, in his case, just about everything, narcotics, alcohol. She described him as someone who had impulsive personality disorder, and they had a fairly strong family history of addiction problems, alcohol, etc. So needless to say, I didn't have to make a decision then because he was out in Montana. And when he got back, he was still going to be 17. And I wished she would pressed it, but I didn't hear from her again until he was nearly 18. And he was about to turn 18 in the next couple of months. He had come back, but he had not, as she put it, embraced sobriety. And given this man's charm and his impulsive personality disorder, his good looks, and his attraction to perhaps like-minded females, she was sure, despite her provision of all the condoms he could ever want, that he was going to get a girl pregnant at some time in the future. Shortly after he turned 18, I did a consult with him by Skype and by FaceTime. And he's not intellectually impaired whatsoever. He had a pretty good understanding of vasectomy. He had watched our counseling videos and read over our vasectomy page, and he was ready to go. He wasn't enthusiastic, but he wasn't trying to avoid anything. And so I guess I'd kind of open that up to the group and say, you know, is this young man being pressured by his mother? Is he, you know, how would you handle that situation? And again, we're still hoping that we can get the slide so that, because that sort of summarizes the history that I just provided. Ron, I'll ask you first. Your mic is off, Ron. Turn on your mic.
I can't see the slide.
Yeah, the slide didn't come up. I'm sorry.
It had come up first.
He's working on it. Michelle Dubon has a question as well. Here it comes. Maybe. Michelle has a question as well, so go ahead and we'll keep talking.
No, it actually, I had similar cases, and actually in our group, I'm the more, I would say, open to do vasectomy in those cases, but in the case you're describing with drug problems at 17, 18, you don't know when he's going to be 30 or 29 if he's going to still be on drugs. We know that a lot of young people at that age can be on drug. That would be problematic. I wouldn't sleep well if I would be doing the vasectomy.
His mother certainly doesn't sleep well any night without him having a vasectomy. She is convinced that she's going to have to raise his child. As I say, he's attracted to girls who perhaps have his limited level of responsibility and impulsive personality disorder. I will say that it would always makes me feel better when a young man stores sperm. And he was in the process of doing that. It sort of diminishes, at least in my mind, the finality of the procedure. It's nice to know that I think of what I would do if my own son had never had children or had wanted to get a vasectomy at an earlier age, that I would probably be more comfortable with him doing that if I knew that he had stored sperm. Not that there's any guarantee that it's going to work, but it just would make me sleep a little bit more comfortably knowing that. But her mother was not sleeping comfortably. And my heart went out for this poor woman who has just been through hell with this poor guy, because nobody likes to lose a loved one to addiction problems. And here she was this woman was a pharmaceutical representative, very well spoken, very well educated. Any comments? We have a comment from Michelle Dubon in Guatemala. 18 years is the age to vote, drink, and decide to have a vasectomy. 3 to 5% of the men that we provide vasectomy to don't have kids. So generally, I've had a little bit higher cutoff. Michelle, do you feel comfortable doing someone who's 18, or do you kind of wish that they would wait until they're a little older?
No, actually, since COVID, we're asking the people like you, some of you are doing, to register, and I would say every 2 weeks, we have this type of man, 21, no kids, no partner, and they remain. We're the four of us to look in sequence the patient, and those patients are remaining at the top list because nobody wants to talk to them. And at one point, okay, I take my courage and I do the call. We have one now. I know 24, no kids, no partner. So we're gonna have to do that. But I'm a little reluctant. I'm telling you the truth, and sometimes I'm saying, let's go to a family planning clinic with when they have a partner. Actually, go to a family planning clinic just to see if there's no other alternative. And I postpone them a little bit, but at one point, if I have the sense that they're really making an informed consent, I did some 18, 20, 24, 25, a little more, a little more at ease.
Michelle in Australia, it's really big within the vegan movement, in the hardline vegans that care about the climate and all that sort of stuff. I had one yesterday, well, 2 days ago now, it's Friday, who was 24. And I mean, a lot of those are vegans in Australia. We get a lot of people coming in, and it's just becoming much more common. On Friday, I did 18 vasectomies. 3 had no children. Now, 2 were sort of normal in that they were like 32 and 38. And then you say to them, why didn't you get it done earlier? And they say, because Michelle Lebrec and Dougie wouldn't do it when I was 18. And I've known all my life. And bloody Michelle and bloody Dougie were useless.
I just want to say that I don't think age is any kind of determinant. I really don't. I think that men at age 18 can go fight in war, they can get killed, they can make all kinds of life decisions. It's the quality of their decision, and I think Doug, you had a very good point on your patient. If he and his mother can afford and are willing to store sperm, that's an excellent fallback. But this guy's going to go out and get people pregnant, and the damage that's done by that is going to so outweigh the potential risk to his later life of having had a vasectomy when he was young. I just think you have to be there for your patient, whatever is in his best interest.
Thanks. Nat is in Brisbane. It's 3:48 a.m. So I want to catch what he has to say before he falls asleep. Nat, turn on your microphone.
Can you hear me?
Yes.
So I just had 2 points. So I think, yeah, I have no qualms about doing vasectomies on very, young men without children. My experience is that the 18 and 19 and 20-year-olds that come in requesting a vasectomy are perhaps wise beyond their years, to even be considering a vasectomy at that age. They're definitely more thoughtful than what I was at 18. And my second point, which is probably a interesting kind of point, I know a lot of some urologists have a perspective that some urologists in Australia don't like me because I go, oh yeah, you're over 18, let's do a vasectomy. And then the urologist will perhaps see them for their reversals and say, Nat, you're reckless, you shouldn't be doing vasectomies on these guys. Whereas some gynecology friends and obstetric friends who do terminations and see the guys who have been knocked back for a vasectomy and then wind up having a termination. So I think, it's good to have these discussions, but I think we can be skewed thinking of it from a purely urological bent because we don't see the couples that end up with going for a termination after being knocked back for a vasectomy.
Sure.
Maybe
being on
maybe
both
with some.
sides of it, I will say that we, you know, we have run about 10% of men who have never had vasectomies. Of the reversals that I do, about at least half of them are men whose vasectomies I have done or my associate John has done, just because guys interested in a reversal usually call the guy who did the vasectomy first. And I will say that fewer than 10% of my reversal patients have no children. So in other words, you would expect that if being child-free was a risk factor for regret, I would have higher than 10% coming in for vasectomy reversals. But I don't think that's the case. I think that the men who've had children find children acceptable, and having more children with a new partner is also acceptable.
Yeah.
Whereas the men who are child-free find children unacceptable, and many of them stay with, now some of them change, you know, they met the magic girl and she inspired within them feelings that they never knew were there. But for the majority of them, I would say that their aversion to children is lifelong.
Yeah.
Doug,
You know,
that's
and
evidence-based too. Michelle, it might be your study, but the doing a vasectomy on a man without children, that guy is less likely to seek a reversal than someone who already has children.
I don't have the actually there was a study done in Quebec, and young people with no children were more at risk. But the problem in Quebec, we have data on what is on reversal and vasectomy, and on every 30 patient that I vasectomize, one will get a reversal at one point during his life. So that's quite high, because we have it's a ratio, okay? Because it's a ratio. It's not exactly the same patient, but in Quebec it's about 3% the ratio of reversal on vasectomy. So it means that every 33 patient that I see, I'm missing the point. He's going to get a reversal in his life. So in some patient it might be okay. In some others it can be a disaster, that they were vasectomized. So but we don't have the answer for everybody. As Ron said in the beginning, you know, it's all individual. So.
But to Nat's point, you've prevented pregnancies in the meantime, and
I did.
Pregnancy, it can be huge, whether it's
Yeah.
a terminated pregnancy or an unwanted live born. We have to remember that that's what we're doing.